Hello, guys. Welcome to Tech. It's another exciting edition today. And today we will be talking about data analysis and everything around it. We are having a professional here that will help us have such a discussion. And he is no other than Tosin Emmanuel. Tosin is the co-founder of TechWay Consult. He is also a medical practitioner. He uses technology in the field of, the medical field. Tosin, you are welcome to Tech.
Yeah, thank you very much. It's nice being here. It's a good opportunity, and all I have to say is thank you. So, how are you doing?
Great, great, great. So I know I've said so little about you. Your profile is so big and intimidating, right? So can you can you can you just add a little flesh to what I said? Tell us about you and what you do.
Come on, you said it almost all. Actually, I have background in, of course, my name is Tosin Emmanuel, Akini Tosin Emmanuel, and I have background in anatomy. And immediately after my BSc education, of course, my curiosity for technology and how data is being used has pushed me to make inquiry about data and all. Funny enough, I started data even long before I know what data analysis is, because I started by analyzing financial market like the cryptocurrency market and all those kind of stuff. But as times goes on, broken into tech. So I'm a data analyst overall. I've been opportunity to work with few hospitals here in Nigeria, and I'm a freelancer as well as a data analyst. I'm a freelancer for work, and what more? So that's what I do. That's just me. Then definitely I'm a co-founder of Tech We Consult. This is a tech company that deal with education, tech education, data analysis. We make sure tech education is make extremely affordable for individuals who want to break into the tech space, especially with data. So yeah, that's what we do. That's me.
Okay, so yes, you're the co-founder of TechWay's Consult. So take us deeper into what you do at TechWay Consult.
Yeah, basically the idea, naturally for me, I'm a kind of I am a freelancer. I work with one or two companies and all, but naturally I'm a kind of person who is very much interested in education, and I I love. I think it's just my thing to break down complex topics and stuffs like that for people, and I see it as an opportunity. So this is why Tech We Consult, come into play. And what we majorly do in Tech We Consult is we just like I said earlier, we make tech education extremely, affordable for people. We make it breaking down complex topic regardless of your background. Either you are into tech before or you're not into tech before. All you have to do is just, come in into tech consultant, or you just get introduced to this, and we keep expanding anyways. Before we offer data analysis courses, now we offer courses on software development. I think on front end. So we keep, looking for qualified professionals in this field that can take people, not just take people, make this thing extremely simple. Because when people hear about coding and all those stuff, they run away. Like they don't want to break it. And tech is far more than that. Do you understand? So that's what we do. We look for professionals in the field and that can, break down complex topic for people. And that's what we do. And not just that, even after your program with Tech We Consult, we always, try to, of course, ensure help you in building your portfolio, having your CV set up, and preparing you, make you job ready. and you'll be taught, of course, how to apply for jobs and stuff like that. So this is what we majorly do in Tech Week Concert.
Okay. So, how is the turnout so far? Like, do you think Nigerian youths are interested in data analysis, to learn data analysis? Do you think, or technology as a whole, do you think there is this interest coming from Nigerians?
To be honest, I think that there's a great turn-up from Nigerians. To be honest, and I think the problem here is that Nigerian youths almost like we don't have a choice, because look at the government, look at the economy, look at what is happening in this country. It's more like there's no much opportunity, and every slide of opportunity that comes to Nigerians as a youth, they make absolutely good use of it. So the turnover has been really quite good. And what is really just bringing down Nigerian youth into this tech space, I will tell you, is just the economy. Majority of them do have access to good laptops, good phones, and they find it very difficult to take tech courses. And but trust me when I say the few people who are just opportunity, they have their laptop ready, their phones ready, and stuff like that, they take this opportunity quite well. And others who don't, it's just based on, should I say, financial constraints and all. Of course, we've got some sponsors though that subsidize things that help tech with consult, just to make this tech education free to people as much as we can. And I would love to tell you that it's not even only Nigerians living in Nigerians that are taking this opportunity. We have a lot of students in the UK, in Canada, Germany, and I think Ireland, Finland as well. Students abroad, international students that really taking up these courses because it's quite a great, opportunity for them to break into the next step or next phase in their life. Yeah.
Okay, great. So, what does it mean to be a data analyst? Like, what is the job of a data analyst?
All right. I'll just like me, I love to simplify things. I don't like giving people big English just to confuse them. I love to simplify. Just the name implies data analysis. We are in an era whereby we have much data being generated every day, just like you don't know. You pay for data every day. I am on this platform because I pay for data, right? To MTN. It's not just called data because it is data. It's called data because it's used, that data we are buying is used to generate data on the internet. This meeting we're having right now is the data being recorded with, I think, StreamYard. If we're on Zoom, Zoom is also recording this data. They have the data. MTN, if we're on call, they are generating data. If you snap a picture, post it online, that's the data. So data have been generated every day, and it's quite smart of technology because we have to make good use of this data to make informed decision on our business. Have you even wonder? Sometimes when you're on TikTok, for example, you watch football videos. What does TikTok does? They keep giving you football videos because they've analyzed what you love, like you love football. So they
Yeah.
give you more football just to tie you down to that particular complaint, to that social media platform, make more money. So they are making more decisions based on data. So what do you do as a data analyst for a complaint in business or anything? What you simply do is just get a data, you analyze data, visualize data, just to make an informed decision for the complaint. And trust me when I say this, regardless of your background, regardless of what you have, every particular sector is using data, needs data, and they need to make an informed decisions about data.
Okay. Okay. So what does it take to be a data analyst? So what should I do, as maybe I am coming from, for instance, journalism, and I want to be a data analyst? What does it take?
Well, the first thing I think for you to be a data analyst is just you need a skill. That's just the reality. You need a skill, and um, of course, there are some tools. There are a lot of tools that can make you a data analyst. But I would be straightforward to you. You don't need to learn all the tools in the world to be a data analyst. That would be a hell of work, and you confuse yourself. So you have some major tools that helps you to be data analyst. Of course, number one is Excel. I made a post online. And I was telling people that if only the only thing you know is Excel, Microsoft Excel, you will ball. Trust me, there are people who keep bringing jobs online on Upwork and all stuff like this because of issues with Excel, having to analyze data with Excel. So you need your knowledge in Excel, you need your knowledge in structure query language, you need your knowledge in the skills. Let me just stop saying knowledge. The skills in structure query language, skills in Tableau, skills in Power BI. With these alone, I think you are well good to go as a data analyst to analyze data, to visualize data, and all. Definitely, your skills in R programming, Python, and those stuff is quite. Some people even use SPSS and stuff like that. So it's great. So if you have these skills, I think you are good to go as a data analyst. So if you want to be a data analyst, your first step is just have the passion. And you want to be a data analyst. If you can find a good resource online, you need to be draining from you find, or find a good tech education company that could help you, narrow down, let you know exact things you're meant to know, and break it down for you. Have your laptop ready, good internet connection, done. You're on your way.
Great. Okay, so you are in professionally, you are in the medical line, right? And here you are, a teacher in tech. How do you combine these two roles as a person? How do you manage to navigate these two professions?
To me, it's quite easy. I have background in anatomy. The funniest thing is that I'm on a call with a friend last week. He's a medical doctor. I needed his what do you say? His I needed his official email just to apply for some stuff online. Trust me, this guy, I knew him as a medical doctor. When I called him, said, "Bro, I've not been practicing for a long time. I'm a software engineer, right?" So not really if you have a medical background or whatever background you have, doesn't really sometimes doesn't even take combining. What it takes is focusing on what you really love, right? So I am in anatomy, having opportunity to work with your hospital and all that. So currently I won't say I'm not even really into these hospital settings of a thing. I'm more like really into the data analysis of a thing in every sense, analyzing financial data. Of course, if there's a project, recently I worked on a project, a Sierra Leone, what's it called, malaria data sets on their, what's it called, on their portal, forgotten the portal. If that kind of health related project, comes in, definitely I'll handle that kind of project and do it. And also, I think it's quite easy. It's just all about the focus and what you really want to do, what really wants to get you there.
Hmm. You are really doing a lot. Yeah. So do you think the healthcare sector in Nigeria or in Africa, do you think they are embracing technology?
To be honest, healthcare in Nigeria, embracing technology, everything about Africa is a little bit slow, to be honest. It's very rare for you to go to any hospital setting in Nigeria, or I know about Nigeria. I've not really been to other African countries before. But in Nigeria, it's very hard for you to go to any hospital settings and you see them, okay, though they might have data, of course, these hospitals, regardless, they have their cards, they have their data, but really analyzing this data and using it to improve their services and all, it's quite rare. So I would say the way the embracing of technology in Nigeria for healthcare system is a little bit low. It's a little bit low. And of course, I think it's generally not just the data aspect, the general aspect of our healthcare system in Nigeria. I saw something on Twitter yesterday. It said, even if you have money in Nigeria, you're not safe. Someone who has money go to hospital yesterday on Twitter, just wrong blood transfusion, the guy is died. He's gone. I think in Abuja or something. I don't know the source of the news, but I believe these are things that happen. So everything is a little bit slow. But what is really embracing data in Nigeria, I think, is maybe the government organization. What was it called? Maybe you the carrying out projects, or WHO carrying out projects on maybe malaria, cholera, and stuff like that. So people like that, I think they embrace data and stuff. So I think that's just the institutional things with the health system in Nigeria.
Hmm. So definitely, we still have a long way to go in terms
Come
of
on.
inculcating tech into the medical line.
A very, very long way. Very, very long way.
Okay, so why do you think data analysis is important to the health sector? Why should, I mean, those in the health sector, why should they embrace data analysis?
Yeah, I think data analysis is important to not just X sector, every sector, to be honest. Every sector, to be honest. In terms of healthcare management, first, healthcare management, how do you manage your facilities, your drugs, your stuffs coming in? If there is data, you could easily know the drugs that are expiring soon, what it meant to do about these things. These things happening every. There's an hospital here in Nigeria, in Ibadan, I think, that recently administering expiring drugs to the patients. They have a good. If they look into their data quite well, you could possibly tell that getting drugs that will expire in the next 1 year into your pharmacy, most of time tends to get expired with you. If they have this kind of data running all the time, they know that, okay, if we are buying any drug into this pharmacy in this hospital, that drug must be like 4 years because of the number of patients that are coming in, because of and how often do we use these drugs. So in terms of healthcare management generally, trust me, data analysis will play a very good role in terms of even prescriptions from doctors and all that. If prescriptions are being put into data, you could clearly know that, okay, these drugs work better, these drugs does not work better. It will save doctors a lot of stress. Do you understand? Preventive medicine is there. Data analysis and preventive medicine, like public health and stuff like that. Because you know, I think there's a saying, I don't know how it goes, like if the preventive medicine is very high, then we have few people in the hospital. Maybe there are doctors and nurses right now will not be overwhelmed and with the weight situation of things. And so employing data analysis and preventive medicine, and knowing the area that are prone to a particular illness and stuff like that, and how they could prevent that, we could really even put a lot of stress off the hospitals, the hospitals we have in Nigeria. Of course, we have little doctors, but if there's high preventive medicine, analyzing of data, knowing what particular community is facing, and trying to cut all these things down, trust me, it will play a very good role in our health sector in Nigeria. So I think the every sector, medical sector and all, we need data analysis. We need to analyze data, look into this. It will make life extremely easy for us.
You have identified a problem. What solution would you prefer to these challenges?
Yeah, the solution I would have preferred to these challenges, one, um, the way data have been taken, generated. Let me just put that in. A lot of works asked to be done, because the way data have been generated, on what method this data will be generated. If hospitals need this, and I think generally the hospitals, they take data. I won't just doctors are administering drugs and all that. So we have to ensure that there is enough data on ground. Number two, it's quite simple. Get professionals, data analysts into this field that could do these things. Then it's not about just doing them. Implementation of recommendations, because there are instances whereby in health sectors, I believe a lot of data has been analyzed and there are recommendations. Well, the government won't just, our governments now and all stuff, the way health system is. So um, taking notes of recommendations and taking actions on recommendations is very, very important. Two, there are a lot of workforce. I believe there are data analysts out there that could do this job. Get them employed and let them handle these data sets for you. Let them handle generous and notes, take good note of their recommendations. There's no point analyzing data and doing all these things and giving your recommendation and insights, and at the end of the day, actions are not being taken. That's another
True.
aspect entirely. So the solution I'll just give is fine. I believe we have data on ground. Get your data analysts, do some data entry jobs, analyze some data, give recommendations, and hopefully, they will take you to these recommendations.
Thank you very much, Tosin, for this exciting moment with you. All right. It's good to talk to you.
Yeah, thank you very much. Thank you very much. Thanks for having me on board.
I hope we'll see you around next time.
Yeah, sure. Anytime, any day.
All right. Bye.
All right.
Yeah.
All right. Thank